Okay, I wanted to make a quick video giving a little bit of information on next-gen questions. Remember, for my exams, I will try to periodically either use these in class or on an exam, but in a way to where you can really get comfortable with this type of questioning and not feel like it's negatively impacting your grade. So I call it earning proficiency points. If I give you proficiency points for next-gen questions when we get an exam, you'll take these and then you'll get an overall score, like let's say you get an 80%, and then I'll give you proficiency points that get added to your exam grade. So let's say you get a 78 on your exam grade. You do the next-gen questions and you get a 90. That would give you 5 points to add to that 78. So that'd be an 82 you'd end up getting on that exam. So let's look at a couple of different questions. Now, as we go through these questions, I may just select some right or wrong answers. I'm really just not doing this as much as what's the content, as much as I want you guys to just see the different types of questions. So this is a standalone question called a bow tie. In a bow tie question, you have to first identify what condition you think is going on, and then you're going to have to identify what actions you should take and what actions you should monitor. So this tells you to first look at the history and physical, nurse's notes, flow sheet, and orders. So I'm going to briefly select those, and you can pause the video if you actually want to try to answer this on your own. I'll spend about 3 seconds on each of these screens. Now, I found that students a lot of times will get more anxious when they're frantically flipping back and forth in these tabs. So this is a good place where your whiteboard comes in handy. As you select through these tabs, write down just brief pertinent information. 34-year-old female, surgical, or you could put post-op, benign abdominal tumor. Then you'll come over here and we're going to look first at our center because everything builds out from here. You have to select from here. Do we think it is one of these four? So based on what I saw, I'm looking for something respiratory. And from these respiratory ones, I have COPD, tachypnea. I'm going to go ahead and select this because she's young. I didn't really have information to support COPD. And for the other two that are more circulatory, I need more information than what I saw in any of those tabs. So what actions should I take? And here you're going to have to prioritize. A steroid might help with respiratory. Oxygen may help. And then we have apply a pulse oximeter. I do want to know what my pulse ox is, urine sample, and then respiratory assessment. So based on these, I have 4 that could help tachypnea. I have to prioritize. So always remember nursing process. We're going to assess first. So I'm going to do my respiratory assessment and get a pulse ox. And then what are things I would want to monitor? So yeah, we would maybe want to monitor all of these in our post-op patient. We did have some tachycardia, but again, prioritize. We're looking only at what relates to tachypnea. So based on this, I'm going to pick oxygen and signs and symptoms of hypoxemia. Here's another standalone test question that we can look at. And again, I'm going to do the same thing. I'd like you to try to answer this on your own. But as we look through the history and physical, flow sheet, orders, and nurse's notes, I'm going to pause for 3 seconds. If you need to look longer, just press pause on, the video. Now, before I look at all these, I want to see what am I going to be doing here. I'm going to be looking for interventions that I want to include to support the outcome of adequate respiratory and cardiac perfusion for the patient that has tachypnea and tachycardia postoperatively. I just want to make sure nothing has changed. Now, I'm ready to go over here. Each row has to have at least one, but can have more than one. So what does that mean? It means that when I go and let's look at the first row, monitor pain and administer analgesia. If that intervention helps for respiratory, I'm just going to click there. If it's an intervention that helps with cardiac, I'm going to go ahead and press there also. And so I'm going to take away some of mine. I want you to just see what you did. And again, it's not going to let us go on. We have to have at least one in every one of our rows. So I've just randomly selected. You select what you think. And then you'll know the green check marks are what was correct. Now, this question would be worth 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this would be a 10-point question. For every green mark that I missed, so I missed 1, 2, 3, so I would have gotten 7 out of 10 for this question. So how'd you do? Now, this is an unfolding case study, and I know this because it has next. So that means this is going to evolve as it goes on. So again, we need to look at our data, and then we're going to highlight abnormal vital signs. What vital signs are abnormal? And then you're going to click Next. This tells us all we need to look at is our nurse's notes and flow sheets, because we already looked at, this is an unfolding one, so we already know some of the other information. So this question's asking us, what do the findings indicate what might be happening? And so you're just going to say, could this be? Could these findings indicate hypoxemia? Yes or no? Could they indicate underlying hypertension? If you say yes, click hypertension. If you say no, skip it. Do they indicate tachypnea? Do they indicate that there might be an issue with medications? She just came back from surgery, so if you think this might be related, like post-anesthesia, go ahead and select here. Could this be related to pain? If you think that increased systolic blood pressure is related to pain, click there. Do we see any tachycardia? Click here. Is she hypothermic? If so, click there. And do you think she needs nutritional intake? Once you feel confident in what you've selected, move to the next question. And I will go back and we'll look at these answers. We're going to review nurse's notes, H&P, flow sheet, and orders. And then in this question, you're going to just drop down to look for what requires immediate follow-up. So we have to prioritize. We have accessory muscles, still O2, and cyanosis. Assessment that requires immediate follow-up. Not worried about my temperature. I am a little worried about that respiratory rate. I'm not worried about that pain. And so I have 3 things that are abnormal here. 2 are respiratory related, and then 1 is more circulatory. So I'm going to think about my ABCs here. And so pick whichever one you think is most indicative of a problem. I'm going to go ahead and click O2 SAP because that not only is related to respiratory, but it also is kind of giving me a little bit of data as far as perfusion of oxygen. And then I'm going to move forward. Here we've got, again, nurse's notes, orders, and flow sheet. So which of these are we going to, interventions would be included in the plan of care so that we promote respiratory and cardiac perfusion for the patient with hypoxia? And again, every row has to have at least 1, but we can have more than 1. So I'm just going to randomly pick. And once you feel confident, go on. And again, this is going to be one of those that if you miss some, so let's see. So here we had, let's look at how many points was this worth? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And I only missed 1, so I would have gotten 9 out of 10. In this question, we're going to highlight what order requires immediate attention. And you're going to just highlight those. And then this is a drop down. Now on these questions, they must be related in order to get points for this question. So based on the information that we have in our nurse's notes, lab results, imaging, and orders, what do we think is going on? Client appears to have based on the findings of so for me to get correct, like let's say I had picked GERD, I'm going to miss this answer. Even though I got the O2 sat of 96, these have to be related to get them correct. So in order to get points for this question, I had to have resolving hypoxia and O2 sat of 96%. And now I'm just going to show you my questions real quick, and then we'll be done. And that way you can check your work. I really wasn't doing this to teach this content, so I'm not going to go over rationales for any right or wrong answers. I really just hope you can see kind of the types of questions and feel a little bit more confident about the partial scoring of the questions. And I think we've gone through everything now. So hopefully this was helpful. If you have any other questions about NextGen, feel free to set up an appointment with me. Remember, for this next exam, these are just proficiency points, so do not feel stressed or anxious about it. Look at it as a practice, and please take it seriously. Even though these are proficiency points, you don't want to just click to get through it. You want to try to do your best, because that's the only way you'll develop skills on these type of questions that you will see on the HESI counted into your score this semester, and you'll see on NCLEX at the end. They're no longer under research. They will be part of your HESI, and they will be part of your NCLEX. Have a great day.